If you're like me, sometimes you just overdo things. And no matter if you're a pro athlete or just a weekend warrior, tendon injuries, muscle strains, ligament problems, they're a buzzkill, right? And conventional recovery for soft tissue or joint injuries require months of rest, rehab, medication, even surgery. But an innovative treatment promises quicker recovery and less pain so you can get back to the sport you love as quickly as possible.
For any athlete, an injury can be devastating and recovery often takes longer than expected. But what if your own blood could speed up the healing process?
PRP injections can be used to treat a myriad of conditions, from tendon tears, muscle tears, ligament injuries, or partial tears. Even after a person has left surgery and have heard that the recovery is going to take 6 to 8 months, you can use PRP to shorten that time significantly.
Regenerative medicine is at the forefront of healthcare, and physicians across the country are using the EmStyle MSK program to educate and actively involve patients in their treatment journey.
After the blood is extracted from a patient, this is placed into a device called a centrifuge that spins that blood and divides it into all its components according to the density. Now, an expert will look at whatever injury you have, and then they will look at the components and decide, what do I need from here to inject into the patient in order to induce the healing.
I had been playing soccer and I stepped on another player's foot and my ankle rolled, and I was having this pain in my ankle and a constant clicking. I don't think that I would have been able to return to playing without pain and without having to constantly manage the injury if it weren't for the PRP shot that I got from Dr. Irizarry.
Very important is for you to be honest with your doctor and say, you know what, I want pain relief because I want to be able to perform X, Y, and Z activities. And whatever those activities are, it is you working hand in hand with your doctor that can help you get to where you need to be.
Joining me now is EmCyte CEO Patrick Pennie and the NASCAR legend Danica Patrick. Thank you guys for being here. I'm so excited to talk to you. I'm a little more excited to talk to her. I got to start, Patrick. This is a very big deal. I've been a fan of yours forever, and congratulations on everything.
Same here.
You are an inspiration.
Well, I'm a very big health enthusiast, which you'll come to find out in these coming minutes here.
I love it. I love it. So first, I want to hear the story about EmCyte and how you got going from critical care nursing to stem cells.
Doing critical care nursing for a while, I really wanted to be an open heart perfusionist. That was my thing. You know, I moved to Florida and became an open heart perfusionist.
I don't think
for a while.
people know what that even means. You're talking about running the heart-lung machine.
So you're working in open heart surgery, you're on a heart-lung machine, you're the one that keeps the patient alive during open heart surgery.
Literally, he becomes the heart. He is the overseeing the machine.
Goodness.
We become the heart. We also become the full anesthesia for the patient as well. So we are under full management of that patient while the physician is operating on the patient. So I did that for many years. And then transitioning into this industry here in regenerative medicine, I think was just crazy for me because it wasn't anything that I was looking for. Just reading an article, it was an ointment that had platelet-derived growth factor used to heal chronic non-healing wounds. I thought that if a recombinant single growth factor can help a wound heal, how much better would that wound heal if you use growth factors from the patient's own platelets?
And you have a very personal story with this.
Yeah, so my dad has had shoulder issues for a long time and would ache to sleep and couldn't sleep, and he was getting even epidurals to just numb the pain, and at some point in time you just can't do that anymore, and so surgery became one of the nebecause
and by the surgery for that, it's like a shoulder replacement.
Orthoscopic.
Orthoscopic.
Oh, just repair, not a replacement. Because when you get all of them messed up like you had described your dad's to me, they start talking about shoulder replacements.
Well, he had 4 tears. You would probably know better than me.
I tell you why I know, because they're talking about that for me at one point.
Oh,
and I was like, no way.
So this came up as an option, and he just didn't really want surgery. And he's like, let's try this option. And so he went down and saw Patrick and had both of his shoulders done, of which he had 4 tears in each shoulder. And his right shoulder, he had a hole in his tendon. So when he went in and had this done, the hole was filled. The right shoulder that was done is 100% healed. So much that he liked these procedures, and they basically were a complete fix for him, that he had an issue with his heel, with his Achilles. And so he went in 6 months ago and had his Achilles done. And so he said that he literally every step was pain. And he said, no pain now. And that he's so glad he's done both of them.
How did you find Patrick?
That's a great question. I
Yeah,
feel like we found each other. I think a lot of my life after racing has been about health and wellness.
But I'm not sure the average person appreciates that race car driving, you're an athlete. That's an athletic endeavor.
But I just think in general, as an athlete, you have a level of awareness for the body. And it's just such a booming market of ways to optimize your health and even like just increase longevity.
How does somebody know whether they're a candidate?
I think if you have a joint injury or joint pain, then you need to call us.
You guys, I so appreciate you being here. Thank you for sharing your parents' story. Thank you for your journey and the incredible technologies. I just am so grateful you were here. Thank you. And to find out more of the incredible things that regenerative medicine can do, I want you to go to EmCyte.com. That is EMCYTE.com, EmCyte.com. We'll be right back.